my name is Jonathan Garcia, nursing student. I will be demonstrating 3 different injections, actually 2, and explaining the third one. The 2 that I will be demonstrating with this orange are the intramuscular IM and subq, subcutaneous injections, and the intradermal is a little bit different. So I gather all my materials. Patient name is Sally Smith. Date of birth is 6/8/55. And I have 3 injections I have to give her. So the first one, I'll get my MAR, read the physician's orders. The first one is 1.5 milliliters of saline intramuscularly one time now, and 0.5 milliliters of saline subq one time now. And the last one is 0.3 milliliters of saline intradermally, ID, stat. So again, I will check my medication twice before going into the room, and then the third time in the room, it will be with the patient. So I gather all my supplies, and then I come into the room, and then I verify with the patient twice. So I ask her name, Sally Smith, and then her date of birth, 6/8/55. She gives it to me. So I verify that it's the right patient. So now we'll do my last check for my medication. So patient name is Sally Smith. Today is April 26th, and we'll say it's noon, 12:26. 1.5 milliliters of saline to be given intramuscularly one time now. Sorry, I did that. Then I get my second one, 0.5 milliliters of saline subq to be administered one time now. And then my third medication will be 0.3 milliliters of saline to be administered intradermally, stat. So that is my third check for my medication. So then I do make sure that we have everything that we need before we get in there. So for the we'll do the intramuscular one first. I will do it for the dorsal gluteal muscle. So I will perform my hand hygiene, put on my gloves. Mrs. Smith, put her in the prone position, belly down, and I will look for 2 landmarks. I will look for the great trochanter, and then I will look for the iliac crest. Right. So once I found them, I will draw an imaginary line going across, touching both, and then on this side of the line, on the lateral side of the line, is where I will put my injection, because if I do it on the medial side, I might hit a nerve. Okay, so I did my third check for my medication. I checked my patient. I put her in a prone position. So now we'll do the dorsal gluteal muscle. So I get my first syringe and needle, right gauge, right length. I grab my medication. I will clean her for 3 to 5 seconds, about 2 inches, just to get rid of all the germs that are right there. And I will put my needle in my vial, and then I will turn it, and then making sure that I have no air bubbles, I will do 1.5 milliliters of saline. Okay. So now, here is my crest, and here's my trochanter. Mrs. Smith is in the prone position. I will inject her at a 90-degree angle. I will aspirate before, just to make sure I didn't hit anything. There's no blood coming out. So now I will inject medication. Everything has to be in there. Leave the needle in there for a few seconds, about 10 seconds, to make sure everything's in there. Then bring the needle out nice and slow. Activate the safety on the needle. and then you throw it into the sharps container. And then you don't massage the injection. You kind of like just pat it just to make sure that it's not bleeding. And if it is bleeding, you could always put a Band-Aid on it. So that was the intramuscular. Now the subq. So again, I did all the steps that I did before. I already have my medication. So now Miss Smith, if I do it at the same time, if I do it another time, I will come and do the same thing, sanitize my hands, and then she will be in a supine position because I will give her the subq injection in her abdomen. So I sit her down, and so Miss Smith is now. I lay her down on her back. Now she's fully laid down. I'll find her umbilical region, and then I will go about 2 inches away from the umbilical. I will also ask her if she's had any other shots around to avoid those places, so I could put a shot in a different place. So again, I already verified my medication, 0.5 milliliters of saline to be administered subq 1 time now. All right, so I have my syringe and my needle, correct length and gauge. Again, I will 2 inches away from the umbilical area. I will clean, wipe. I will make sure that I have my vial ready, and then I'll do the same thing. I will do 0.5 this time, just to make sure I don't have any air bubbles. I will not have to aspirate this time. So I will 2 inches away. I will pinch it a little bit between my index and my thumb, going in at a 90-degree angle. Administer all the medication, and then pull it out nice and slow. Activate the security features on your stuff, and then throw it into the sharps container. And then again, don't massage. You just pat. If it's bleeding a little bit, you could always use this again. So that was for the intramuscular, and then I document everything correctly. Now I will explain the intradermal. For the intradermal, we can use about the same gauge and length that we did for the subq. So I would use the forearm of the patient. Again, I would clean it. Again, if it was Mrs. Smith, I would come in, explain to her everything, do my 3rd check, medication right there with her, make sure it's her, ask her date of birth and her name, and I would do the intradermal. So the first one I did was the intramuscular. The second one was the subq. This one is intradermal. So I clean the area where I'm gonna do my injection. Again, I'm gonna use, because it's the same one, I'll uncap it, same gauge and length. I would put it in at a 10-degree angle, the injection. I will also inject everything, and a little wheel will appear on the skin, which is like a little raised bump. You inject all the medication at a 10-degree angle, and then you pull it out at the same angle. Again, you get rid of your needles in a safe place. For the intramuscular, I forgot to say that when you're doing it, when if we're doing the dorsogluteal muscle, I would inject, and I would let go of my non-dominant hand. I would stabilize the needle, and I would inject. That's what I would do for the intramuscular. I forgot to do it. Intramuscular, subq, and ID, intradermal. you have to pick the right gauge, the right length, and the right medication. Thank you.